Hi, my name is Dr. Gordon Rye. Patients often ask me what are my options for replacing a missing tooth. The first option would be to do nothing, leave the space as long as you're comfortable with it aesthetically. The difficulty with leaving the space is that sometimes the bite will collapse. The teeth will move into the space and they'll change your bite and cause other symptoms. The second option you have is to do something called a flipper, which is just a temporary replacement for the tooth, usually for aesthetic reasons only. That's nice because it's very inexpensive and it's non-invasive. It doesn't involve changing the other teeth in any way. It's usually only good for front teeth though. It doesn't work very well for function. The reason it's called a flipper is because when you bite down on something like a sandwich, it flips out of position. The third option is to do a removable partial denture, which is something that clips in and out. It's more stable and it looks better. The disadvantage is it gets a little bit more expensive, and partial dentures put pressures on the other teeth sometimes, even if they're made well, and sometimes it'll cause problems with the other teeth. The next option is to make a bridge. Now, bridges are excellent in that they are very good aesthetically, and they're functional in that they can be chewed on. You can function with them. You don't have to worry about them coming loose. The disadvantage to a bridge is that you usually have to do something to the teeth on either side. You have to involve them in an irreversible way. The other thing is the cost gets a little higher with a bridge, and the bridges statistically have a success rate of about 12 to 14 years in this country. And 60% of the time when you lose a bridge, you're losing it because one of the two teeth that are holding the bridge in has a problem and is lost. The last option is to place an implant where the missing tooth is. The advantage to that is it has a success rate of about 95 to 98% over 30 years. It can be very aesthetically done usually. The disadvantages are it can be expensive, about the same cost as a bridge unless there are complications. It involves a surgical procedure, involves a little bit of healing time, but it's very functional, can be very aesthetic, and is an excellent option. So if you're interested in having a tooth replaced, ask your dentist. I'm sure he can help you. Thank you.